You have volume. Hello? Yeah, I got volume now. You good?
Um,
So good morning, folks. Welcome to our monthly meeting of GSPS Board. Matthew, I believe you have a motion for us.
yes, thank you. At today's closed meeting, the board dealt with the following matters, discussing and approving confidential matters pursuant to section 44.2 of the CSPA.
We have a motion to move out of in camera, please. Matthew,
Uh, that is our motion.
duly moved and seconded. All those in favor, it's carried. I call upon Member Forche to do our land acknowledgement.
The Greater Sudbury Police Service strives to build positive and respectful relationships with the original inhabitants of the land, including First Nation people, Métis peoples, and Inuit. It is in this spirit that we, as a service, honor and acknowledge that we serve in this land that is cared for from time immemorial by the Anishinaabe people of the Three Fires Confederacy. We further acknowledge this land as the Dish with One Spoon and the Robinson-Huron Treaty Region. In peace, our first duty.
Thank you, Member Forche. I'm adopting perhaps a newer way to do our roll call. Our administrator does have a good set of eyes on him, and she's noting who's present and who's absent, so we won't go through that present thing. So Administrator Gatien, you've noted who's here and who's away.
Yes, thank you.
Declarations of conflict of interest. Hearing none. Our presentation by Dr. Coca and his associate, I don't see Dr. Coca and his associate here. So in the effort of time, perhaps we'll go into our consent agenda that has been circulated to the board in their binders. And that's number 7 to 710. Does any of the board have any comments or questions with regard to the consent agenda? John? Paul?
No.
So in my discussions with the chief, we also have our report with regard to complaints. And Chief, perhaps you could just highlight that for the benefit of the board and the community.
Yes, thank you through you, Chair Lougheed. As the board would have read in the report here, we transitioned last year on April 1st to the Community Safety and Policing Act, which moved us from the old Police Services Act. And now our reporting structure is a little bit different under the CSPA. We used to report to the OIPRD, and now it's through LECA. And you'll see that our complaints are listed, and we did a comparison the prior to April 2024, as well as what we've been incurring since. And there's an outline here of all of our complaints over the last year. It has been a bit of a transition, not only for GSPS, but across the province. The staffing at LECA, isn't as robust as it should be. And so there has been some delays, but I'm happy to report as of today that we are compliant with all of our complaints. We did
save $12,000 for the taxpayers of Ontario. We are a very efficient board that doesn't necessarily travel when we don't have to. And I think that's pretty much all that I highlighted with our discussion last week, Chief. Is there anything else you want to add?
No, I'll just note, as well as chief complaints were in this report as well. So along with our public complaints as well, we have under the Act chief's complaints. You will note that there were 12 new chief complaints, 7 of which were under the old Act, 2 of which were under the new Act, and 3 were under our Civilian Discipline Act. You will see that we lost jurisdiction over one, and that was a member resigned out of the organization. So I thought the board would have questions on that. But again, those 12 have all been dealt with.
Thanks, Chief. Hearing nothing else on the consent, I will mention that I see our presenters have now arrived. By the way, I guess in my being old and decrepit, my eyes are playing a little bit of tricks. We should likely have the motion to adopt the minutes of March 18th, 2025, Matthew.
Yeah, I can read that out for you, Chair. At the Greater Sudbury Police Service Board, minutes of March 18th, 2025, be adopted as circulated and read. And then the next motion that the Greater Sudbury Police Service Board approves and receives the consent and discussion agenda items for the April 16th, 2025 meeting as distributed.
Those have been duly moved and seconded. Any discussions? All those in favor, and they are carried. Dr. Koka, if you'd like to come forward with your associate. So, friends and community, I don't think Dr. Koka is a stranger to anyone here. He actually sat on the Police Services Board a few years back. His official title is Medical Director of Mental Health and Addictions at Health Science North. If you remember, we had a presentation a couple meetings ago with regard to the Drug Enforcement Unit. At that meeting, there was some significant issues with regard to, is this epidemic in our community? And should we be asking for emergency resources and an emergency motion? So in following that discussion up, I invited this community presentation by Dr. Koka, who is well qualified. Bear with Dr. Koka. Rita will speak to the microphone because he's had laryngitis for four weeks. As an undertaker, I'm very worried about that prognosis. I've asked him to see a doctor, and he promises he will. So Rita, you do have an associate to help you, and I think, Matthew, you have a PowerPoint. So I turn it over to you, Dr. Koka.
Thank you, Mr. Chair, for that kind introduction. You can see that I'm not the same voice I have. And members of the board and the senior staff, Chief Cunningham, and all the senior members and the staff here, I know all. So thank you very much for inviting us. So, of course, I've been in mental health for the last 39 years, and I see a lot of them, mental health and addiction together. And I was on this week, this Monday on call, and I see quite a few children and adolescents as well. And I received one patient from up north, the Ottawa Pascot, so as well. So, but yeah, we see that all the time. Both addictions of all kinds, including fentanyl. Of course, I go to Highland. I see that also a lot of people. So I'm going to ask my colleague to present because Tara Leary is more equipped and more qualified than me with regard to addiction medicine. She's an addiction medicine specialist. She's our lead for HSN, and she's also lead for Northern Ontario, as well as also she's a associate professor at the NOSM University, and she's also in the continuing education director also. She also is a lead for the Ontario Health for Northeastern Ontario here. So I think she's well qualified. I'm going to ask her to do the presentation. Last night we presented to the city. Some of the members who were there met. See it as repeating some of the slides, but we're together. Same statistics, same services. Thank you. Tara?
Thank you, Dr. Koka. And thanks for the invitation for us to share our perspective on substance use here in Sudbury while I figure out the AV. So, of course, perspective depends on your viewpoint, and we wanted to look both superficially at what everybody sees and what many folks deal with day to day, as well as take a deeper dive into some of the underlying issues and some of the emerging issues. So what we see on the surface is not a surprise. We see open drug use, the associated paraphernalia that goes with that, discarded in public places. We see unhoused folks living in encampments around the city. Our paramedic services respond to almost 2 calls a day for opiate-related incidents or suspected opiate-related incidents. And national statistics speak to the link between substance use and criminality, not just with opiates. In fact, it typically is led by things like alcohol and stimulants, but everything is in the mix. And we're not immune at the hospital. So what does it look like for us? As many of you may have seen last night at the presentation, over 25,000 inpatient days associated with substance use. And that's not just people presenting intoxicated or in withdrawal, it's people presenting with the medical fallout from substance use, acute and chronic, the psychiatric complications that come along with substance use, as well as the substance use itself. We work closely together with psychiatry because about 1 in 4 of our substance use cohort also has a comorbid psychiatric condition. So that's roughly 2,500 emergency department visits associated with substance use every year. And to break that down, that's about 7 a day, which means every 3.5 hours, somebody's presenting to our emergency department with a substance-related concern. And about 1/3 of them come back within 30 days. Now, we published results about 2 years ago showing that some of the services that we have initiated at the hospital have reduced the likelihood of people coming back within 30 days, but we still have 1 in 3 who need to revisit. And that shouldn't come as a surprise, really, because if you're younger than 50 in Sudbury, you are most likely to die from a substance-related overdose, more than anything else. So what's the link between homelessness and substance use? Well, at the hospital, we've seen a substantial increase in emergency department visits by folks who are unhoused over the last several years, to the tune of about 2,000 visits by the cohort that is on the by names list, give or take 500 people. Unfortunately, an increasing proportion is represented by our youth. So at last count, that was 11% youth and transitional aged youth, so under 25. And yet, when we look specifically at our substance use cohort, 4 out of 5 people in the hospital with substance use are actually housed. And so that means that what we see is really just the tip of the iceberg. And so what's happening under the surface? What's contributing to this? What's coming up the pipe? Well, we have prolonged hospital stays because of substance use. We have repeat ED visits. And it's not just opiates. Alcohol accounts for almost half of our hospitalizations. And really, like many chronic illnesses, it's because of a lack of community treatment. So we have a lack of resources in the community that help prevent people showing up in the hospital in the first place. And then once we're able to stabilize their illness, their infection, their psychiatric condition, their addiction, we have a lack of wraparound services in the community that help maintain that stability. I would call on things like the Diabetes Education Center, cardiac rehab as examples of chronic illness wraparound supports that are lacking in the field that we work in. Add to that the fact that it's really easy to get substances these days, increasingly so. So policing can speak to the access to illegal substances. We can all see the access to legalized substances, alcohol, cannabis, compounded obviously by unemployment, financial challenges, housing instability. And yet in Sudbury proper, almost 3 in 4 overdoses happen in a home. They don't happen among the homeless. And last but not least, the supply of illicit substances is changing. Polysubstance is by far the most common. We're seeing increased mixes with stimulants as well as veterinary grade sedatives and a variety of other creative combinations. That has changed the pattern of use. People still use stimulants intravenously, but increasingly they are using their opiates by inhalation only. And unfortunately, again, we are seeing an increase in youth involvement in the drug culture. And so what does youth involvement look like? With the hospital, that's 167% increase in hospital days for our youth under the age of 18 in the last 5 years. It's a 30% increase in emergency department visits, and it's a 67% increase in overdoses. And so our takeaways, not surprisingly, is Sudbury has some of the highest rates of substance use, harms, and mortality in Ontario. We typically run about twice the provincial average. We have on occasion run 3 times the provincial average. We're happy to say that we are no longer. But maybe more surprisingly is that alcohol is as big, if not bigger, a factor from a healthcare perspective as opiates and illicit substances. Our trends show increased healthcare utilization, and that indicates that no matter the substance, no matter the age, we need to implement preventative measures across the spectrum. And certainly there's an urgent need to focus on youth. Collaboration with many community partners, including the city, yourselves, paramedicine, they've been critical to making the gains that we have made and in our efforts to address these needs, but we need to keep going, and ideally we would like to do it together. Thank you.
I think, I mean, my experience, I see when I'm on call, for example, at least 3 or 4 with substance use problems. When we do the toxic screen, they have multiple substances. For example, I saw one patient on when I was on Monday, multiple, including fentanyl. You know, fentanyl seemed to go with it because they don't know what they're taking. Sometimes fentanyl is with it, so it's a big problem. In the island, is same. I think Suman Koka that goes there to the island addictions clinic, he experienced the same thing there. I think it's a big problem. This morning, I was speaking to one of my colleagues. He's chair of psychiatry in the NASM, my successor. I was talking to him this morning about something else. I said, Jack, what is the situation there? Big problem. We just swallow it and live with it and it keeps going. See, we lose patients and family members are upset, parents are upset, but that's what they're dealing with. I think we are doing the same thing here. I will be happy to answer any questions, Mr. Chair. Thank you very much.
Thank you, Dr. Koka. Thank you, Dr. Hillary, for questions. Member Lefebvre.
Thank you, Chair Lougheed, and thank you for the presentation. It's quite alarming. We had a great presentation last night at the Community Safety Wellbeing Panel. Yourself, Dr. Koka, was there with Natalie Aubin. Dr. Aubin was there as well to give a presentation. A bit similar to this, but there's a bit more information here as well, a bit different. But a few questions that I have, if you allow me, Chair. If you look at one of the slides with respect to the service delivery trends, factors, homelessness, in that slide, you say that there's 10 individuals accounted for 441 visits. So basically, a quarter of the total visits in this patient demographic. Obviously, this is concerning that there's the repeat, but what are we doing to address this, or what rule changes need to be brought in in order to address this? Because obviously, we're just repeating and the outcomes are the same. So where are the solutions on this? I know it's a simple question, but I know the answer is not simple. But however, this begs a solution that should be certainly we should all be thinking about.
Absolutely, it does. And one of the slides in last night's presentation spoke to the impact that Lotus and the transitional housing program is having for our population. We didn't include that today, but certainly can forward the material. Specifically, our transitional housing project in partnership with the city that is about to expand to 40 beds has been serving approximately 13 beds for the last several years. And we do have a case study. Again, data is a difficult thing to come by. So we have a case study looking entirely at healthcare utilization for that population, and a very dramatic before-after picture of EMS calls and hospital stays and emergency department visits for individuals prior to their involvement with our transitional housing, and then while they're involved in our transitional housing. And transitional housing, both the housing and the wraparound supports, makes a tremendous difference in healthcare utilization. What we don't have to add to that is the difference that we hypothesize that it also makes in terms of EMS and emergency service calls for policing as well.
Exactly. And through you, Chair, so when you mentioned the lack of community services, lack of wraparound services, as was mentioned last night, certainly we believe, or we have hope that the Lotus program, which is the Heart Hub, will certainly be able to address this. Is that what we're all betting on? I guess is that or are there solutions that we're looking at as well?
The 40 beds that's coming on might be helpful, and I think that's not enough. And the heart program that's going to be also coming, so that will also help to a certain extent. But we need more community services. In the hospital system itself, we have added 28-bed unit, AMU addiction medicine special unit, one of its kind in the country. We have used AMC service addiction medicine services all across the entire hospital. We have created so that we can provide service to these people. When they come to the emergency department, what happens is our hands are tied. Their only addictions problem they come in with. I can't certify them, keep them in the hospital unless they're suicidal or homicidal, or physically imminent impairment. Apart from that, otherwise I can't keep them. If they want to go, I'll let them go. That's what happened. If these people, they come and go. Even last night, Monday, I saw this gentleman. He was 4 times presented to the emergency department previously, 4 days. He was in the hospital for 1 week, for example. So it happens all the time. So I had to let him go when they wanted to go. Then they come back again. So unfortunately, we don't have the law to keep them by certifying them, keep vacancies as well.
That's tough. Thank you, Dr. Cook. Anything else?
Well, you mentioned the Heart Hub, and I do have to give a shout out to Sudbury and partners. I wasn't directly involved, so I'm not patting myself on the back, but Sudbury, for our size, was a community that managed to come together, all stakeholders involved in mental health and addictions, and put in one unified application for a Heart Hub, and was successful. There are communities smaller than ours who were not able to come together to put in one unified application and put in several. I have no idea if they were successful, but the fact that we were able to come together to recognize the problem and to unite the resources that we do have in order to deliver the Heart Hub, I think is an excellent first step. We have a lot of work to do to make sure that the appropriate components of that Heart Hub are there, a la diabetes education or cardiac rehab, in terms of building the community, building the supports, building the outreach that is currently lacking in the community.
Yeah, and one of the thing, and thank you for that. One of the things that also came out last night with the partners at the Community Safety Wellbeing panel is that there's not a lot of on the youth side. It's really, as we're seeing more and more presentation of addictions for children youth below the age of 16. And when I look at your slide with respect to children and youth substance use, and we're seeing this curve really exponentially. Now, what was mentioned as well is that we don't have any addiction support services for youth under 16. Is that normal that there is that in the whole province, or is it just us?
So wearing my Ontario Health hat, the youth bucket has not been a priority. So there is nothing particular for youth over and above the priorities that they are rolling out provincially for addictions in general, unfortunately.
So the Lotus program, that's for 16 and above, I assume.
Correct.
So there's nothing for 16 and below.
That is correct.
So how are we going to reverse the curve that we're seeing in that slide that you have on children and youth that is pointing up?
We need to sit down and talk about it.
I don't want to monopolize this. So please
Go ahead.
no,
You got
please,
good
please.
questions.
I was going to ask you a youth question, so I'm.
Well, no, go ahead, John. You always like to ask questions.
I want you to finish, Mayor.
No, please go ahead. You go and I'll go after. Actually, he'll
You'll do it? Okay. So this is usually a summation question because I think our mayor is on a roll, but I will step in. You've talked about the importance of Heart Hub. You've talked about the importance of transitional housing as a key takeaway. And this is an elephant, let's face it, that we're trying to eat. And thank you so much for the presentation. But if you were to break this down to the next 3 steps, because I'm old enough to remember David Letterman, I like my lists. So what would your next top 3 priorities be that you would like to address to start to see some further positive momentum in this very important area?
I didn't have a chance to study for this test. However,
Sorry about that.
That
At least it's your experience.
well, and the ask, the ask differs. I would ask for a lot of things inside our hospital walls, but this isn't the audience to request that from. One of the things that we need to do, we're excited about transitional housing, but if we look at the fact that there are 500 people on the by names list, roughly give or take, and we are opening 40 beds, which we call transitional, and ideally they would be, but there really is not a lot of place for flow throughs for those folks to transition to. We need to increase that capacity tremendously. It's very difficult to treat any sort of illness when somebody is not housed. We wouldn't send them out to the park and expect their broken leg to get better. And so we shouldn't send them out to the park and expect that their addiction or their mental health will improve either. Housing should be a priority so that we can continue to provide the evidence-based care that we provide, and they can have the security of a place to stay.
And also, we don't have many community rehab programs, although we have Monarch, a big wait list. I have patients sitting in the inpatient unit waiting for a service to go somewhere. We send them to the Lake, they have a wait list. North Bay, they have a wait list. Monarch, they have a wait list. So sometimes our patients are sitting in our inpatient unit occupying a bed because they can't go anywhere. I can't discharge them because they're not well enough to be discharged. So I think we need more of the community programs, also rehab programs that will help so that burden on us hospital system.
And not to be too pie in the sky, but when I look at what we do, there's evidence-based treatment for alcohol use disorder. There's evidence-based treatment for opiate use disorder, and with excellent results. But what's lacking in wellness, in addition to housing, is also recreation. And when I look at what falls under a municipal purview, I would say accessible recreation goes a long way towards wellness as well as deterrence.
Education.
We understand that. So you're talking about housing, you're talking about community groups, and you're talking about recreation. So that would be your
We
top
hit our
three.
3.
Educating our patients also helps. Sometimes, of course, I've had some patients of mine. I said, "How many times have you gone under?" "Oh, 4 times." "How did you get out?" "Because somebody was with me." So we educate them to be with somebody when they're using fentanyl. Not that we want them to use fentanyl, but at least survive a few times, then maybe something will click in their brain and then say, "Okay, quit."
Aware why of the invitation today is to provide us with this information. Chief is going to speak after you, and we have a motion, but our motion is with regard to that this is a crisis and an emergency. By putting that motion up, we are actually looking for more resources, but as a police board, we're not telling people where to put the resources, but your questions or your answers today give opportunities that if we could access more resources, those would be priorities. I think that's the object of the exercise. So Mayor, you've got another question.
Yeah, I got a few more maybe. To the chief though, and to the team, I know you've given the stat before, but I'd like to maybe highlight that again, that how often we assist EMS with these individuals that then we have obviously a cruiser and maybe 1 or 2 officers with the cruiser at emergency, right, department waiting to support or because they're supportive of the EMS team that don't feel safe, right?
No, absolutely. And through Deputy Hiltz, we've been working with Deputy Chief Roney and her team. But our assist EMS calls for service went up by 200% last year, and we presented that at our budget meeting. And Chief Nichols was present, and it's unfortunate because the clientele in which they're dealing with are the clientele that go to the ED as well. And working with Dr. Obey, we're all seeing the same clients. And we spoke last night after the community safety and well-being meeting and said, the individual that presented X amount of times at the ED, how many times were they presented with police and with EMS as well? So the drain on emergency services, whether it's the emergency department or police, fire, or ambulance, it is draining. Yeah, and I have lots to say on top of what Dr. Leary and Dr. Koka have said, but I'll wait for my part.
Maybe just on that point, I'd like to know if we have the stats of the individuals that die that should be in care, I guess, or obviously we find them and the deceased and it's determined that it's an accidental overdose. How many of those had a connection to the system, like had been at the emergency department within a month? Like What is the stat on that? Do you guys keep that stat?
That's an excellent question, and the Ontario Coroner's report does speak to that. However, I don't have it at my fingertips. It is alarmingly high, the number of healthcare encounters in the 7 days prior to an overdose death, whether it's through the emergency department or whether it's through primary care, though.
Kind of same topic, though. You, in your presentation, Dr. Lurie, said that 3 out of 4 overdose deaths take place at home. So is this a home in the traditional sense? Is this a flop house where they're renting a room so they can overdose? What is your definition of home?
It's not my definition. It's in the coroner's report and is the address of the deceased.
So it could be a flop house.
Well, I don't know how many people get their ODSP checks delivered to a flop house, but it would be the address which they get, like their legal address where they're receiving mail.
Just where some of my properties are, there are certain houses that are noted to having that problem. So,
Yes.
you're going to say something?
Nothing else to add? Thank you.
Maybe I'll ask one more. I often hear that at the hospital and just in the community, we actually don't only service people of Greater Sudbury, but mainly we're a hub, right? So we service probably a population of 300 to 400,000. And then often people come here to receive services because they can't get them in their small towns. Do you guys see that often, that some of the patients that you can see at the hospital, their address may not be in Sudbury, but may not be outside of Sudbury certainly when they first arrive? You see that, or is that a low number, or is it significant?
It's not as much of a factor for addictions. I mean, people tend not to be as mobile. So we don't take regional referrals. We do have work in place to better assist our surrounding community hospitals with addictions presentations following the footsteps of a very successful telepsychiatry support services. They're identifying a separate need for addictions specific expertise. So Move is afoot with Elliott Lake, Espanola, as well as Little Current to try to better support their staff and their patients on site to minimize referrals that aren't currently happening, but to improve care so that it doesn't become an issue.
So, Your Worship, we do provide service to these communities, by telepsychiatry consultation services to the emergency departments, though they present to the Little Current Emergency Department, Espanola Emergency, or Elliott Lake, or the Brine River. We provide service to these hospitals as emergency psychiatry consultation services. If they need to come into hospital, we take them. Sometimes at night also they come as emergency if they are really severely ill. Yeah. We get sometimes, of course, traveling people from east, south, west. Sometimes they say Sudbury is a nice place, and they see the lakes, they want to stay in Sudbury. So that's what happens occasionally.
Member Forche, do you have any questions?
I don't have any questions. All been answered.
No. Member Fave, any more questions?
Good for now.
Boland? On behalf of all of us in the community, Dr. Coca and Dr. Lurie, thank you very much for an excellent presentation, which again gives us food for thought to be able to try to support your initiatives going forward. So thank you for your time today and for your good information.
Thank you, Mr. Chair and the board, for inviting us.
Thank you very much.
Keeping in mind how we came to this place, if you remember that the Drug Enforcement Unit made a presentation to us a couple meetings ago, and from that meeting, we decided that as a board, we should provide some leadership with regard to appropriate motions to perhaps municipal and provincial governance. I've also asked the chief, who is very familiar with this particular topic, if she now could add her observations and thoughts.
Thank you, Chair Lougheed. And thank you, Dr. Leary, Dr. Coca. Appreciate, of course, your insight, much smarter in this area than we are. But what we learned last night at the Community Safety and Wellbeing presentations, we already knew is it takes collaboration in this space. It's going to take everybody that's working in this space to lean in and do the heavy lifting. And I just want to highlight through the mayor, his efforts in streamlining, who sits at the table. Because when community safety and wellbeing first started here locally, and I sat with then Deputy Weber, there were a lot of well-intended community partners there. Unfortunately, there was not a lot of momentum. And so what I heard last night from the likes of Dr. Obey and, CAS. Just we see the momentum happening. We see the change starting to happen. We see things moving forward. So on behalf of, some of the emergency services, thank you. But, one of the things that Detective Speck and Staff Heffern highlighted is, the supply demand coming into the city is increasing, and we're seeing that the toxicity. And last year we had our toxicity summit. It's increasing. And recently there was a Globe and Mail article, that highlighted the fentanyl opioid crisis here locally. And of course, I think they just highlighted that double, sometimes triple. To the province, and we're doing our part in the enforcement side. I sit at the executive level of the community drug strategy with Dr. Hergy and several members, David McNeil from HSN, again looking at the education component. Making sure that we're letting our community know that there's a toxic strain out in the community. Inspector Depotier as well sits on kind of a steering committee at the I guess, education level, making sure that our community is aware of what's out there. So, just what I wanted to say from our perspective, the enforcement perspective, we continue to do our part. But as a police service, we are embedded in several other areas of the community, ensuring that we're working with our partners at HSN. We're working with our partners at the city and community safety and well-being. We're working with our partners at public health, just ensuring that, we're present. One of the things, and I've said this repeatedly, that Dr. Leary just said is we as a police service struggle with that 2 a.m. call. And I said this again last night, where we take an individual because they, have overdosed to HSN, and they clear them medically, as Dr. Coca said, nothing to keep them, and they go right back out. And that individual will present again because we'll get a call and EMS will go. And so where's the wraparound services? And I think we're struggling locally with services to really support these individuals. I believe yesterday we were notified that Monarch has increased their beds for males, again, which is great. But I just am hoping that moving forward, we're going to see a better, I use the term roadmap, and we spoke about this at the community drug strategy. When someone presents, again, we can't lead a horse to water, but what are the options? The emergency clears them and they release them. But who's following up? And to Dr. Leary's point, when their address is, the park, who's going to follow up the next day? It's not the police. But we really aren't seeing that happen. So anyways, again, we're doing our part, happy to do our part. We're at every table that, we're invited to and participate, and we'll continue to do that and be part of the solution.
Sounds good, Chief. Questions to the Chief? Member Poland? Member Lefebvre?
I know that in her report that she talks, I think she's going to follow up on a few points in your report to us on these earlier.
Okay.
Your chief report, there's some.
Yes, yeah.
Some stats,
Some of
sorry.
the other stuff.
There's some stats that you have it. I'll talk.
Yep.
I'll ask you about those stats because where I'm getting at is basically the health and safety of our community as well. Certainly, we often hear from individuals in the community that they don't feel safe in areas, right? In different areas of the city. So what are we doing to certainly address the safety issue in our community as well? And I know you highlighted that in your report, so we'll talk about that then.
Yeah, and happy to speak about it now. Or do you want me to wait for the chief's report?
Sure. We're on the topic. Let's do it.
For sure. And we've heard that, through our city partners, through the BIA, the downtown business partners, that perception of safety in the community. And, we're alive to it, the open drug use. And I know that's been an issue the previous chief had spoken about. But again, when our public is walking up Medina Lane and there are individuals openly using drugs, we want to address those concerns of safety. So you'll see that last month through Inspector Wilmot as well as Inspector Depotier's areas, we did what was coined, a focused initiative into the downtown core, just arresting individuals related to drug-related crime in the downtown core. And you'll see some of the stats. We executed 57 arrest warrants. Individuals on outstanding charges. We received an estimated street value of $76,000 in drugs. proceeds of crime, and you'll just see cocaine, fentanyl, methamphetamines. They're out there. They're on our streets. We know that. We heard again from our presentation by our drug unit. It's in our city, and we're scraping, just barely scraping the bottom on getting these off our streets. And you're seeing the large quantities of drugs we're seizing, but unfortunately, the demand is there and the supply is there, and we're trying to upset that apple cart. And these initiatives, not only to your point, Member Lefebvre, speak to the community who are openly seeing it, but it also speaks to the individuals that continue to do it. And this isn't going to be a one and done. We're committed to continuing to do this in the downtown core and throughout the city of Greater Sudbury.
Follow up on that one. You talk about certainly trying to disrupt the drug dealers' business in our community. What are we seeing in other communities? How are they approaching it? Because I know we often hear that I get family members that have lost certainly a child, and often a son or daughter, and they often ask, why can't we just charge those drug dealers with murder? Right? It's not that simple. That's what I'm trying to explain that, but as we explain, sometimes we fail to kind of be able to properly address what they're asking. But yeah, so maybe your opinion on that, or your thoughts on, and if we're seeing that across the province, or certainly that desire, because obviously we know that these drugs that we're dealing is not what it was 20 years ago. People didn't die when they took cocaine, but now it's laced with all sorts of other stuff. They don't know what they're taking. That's why we call it accidental overdose. It's an accident, but who obviously sold them these death, substance?
Yeah,
that
for
caused death?
sure. And we see that often. And Inspector Wilmot is here and, overseeing criminal investigations in the drug unit. We recently just, working with a mom who lost her son. And, those questions are being posed to us.
Mhm.
And again, very complex in the sense of the supply chain, right? And even when we're able to identify the actual person who supplied it, there was someone who supplied it. And right, it's following that roadmap. We successfully have laid the charge locally here of, I believe, correct me if I'm wrong, Jerry, you're nodding yes? Manslaughter. And again, it takes a lot of legwork in that. And again, the knowing of what's in the agent that the individual is selling. They probably don't even know. They're saying they're presenting it as cocaine. So it's very complex. And again, we hear the victims and then those questions being posed to us as well. And they're very complex investigations. And our team, when and if they can, they are proceeding with those charges.
I want to certainly congratulate the team certainly on the efforts that you did on the Focus Initiative. And hopefully we'll see more of that, because I think we're seeing effects of that. And certainly as we can prosecute more drug dealers, that's what we should be focused on.
Absolutely. Thank you.
I know I have a property in the midst of this, and I have an alley that very much every morning I have staff that go out and collect syringes, condoms, clothes, etc. When they heard about your sweep, chief, many of my uh, employees are downtown are women, and they felt a lot better that this sweep was happening, because their point always is when somebody is high, they often don't know what they're doing. And so that creates a fear that you go to your car, or visitors to my funeral home or whatever bump into these people. So they thought the sweep was wonderful. The only question they actually raised, do you think they'll do it again? And would it be something that really the downtown community and those visiting it could understand that on a regular basis, you'll be making sure that those folks are just not in your face?
Absolutely. And, as the nice weather comes, we're deploying our bikes back downtown. They're easily accessible in the laneways that you're speaking of, and just greater presence in the downtown area. But we do intend to do another focus initiative coming up shortly.
Any other questions, folks? So I think, Matthew, we're likely ready for you to read the motion.
Great. Thank you, Chair. Whereas in 2021, the Mayor of Greater Sudbury released a statement committing the city to working with community partners to advance our efforts on treatment, prevention, and harm reduction locally. And whereas Public Health Sudbury and Districts passed Motion 14-21, Local and Regional Opioid Crisis Sounding the Alarm, affirming a deepening drug crisis in the Sudbury area. And whereas Public Health Sudbury and Districts passed Motion 39-23, Drug Opioid Crisis Leadership Summit for a local leadership summit on the escalating drug toxicity crisis. And whereas the summary report of the Greater Sudbury Summit on Toxic Drugs was released in early 2024. And whereas the board received a presentation on January 22nd, 2025 from the GSPS Drug Enforcement Unit reviewing the current state of drug issues in Greater Sudbury, including the seizure of over 2,000 grams of fentanyl in 2024. Now, therefore, that the Greater Sudbury Police Service Board recognize the undue burden the toxic drug crisis places on community services in Greater Sudbury, including health services, policing services, and community assistance services, and declares the toxic drug crisis in Sudbury an epidemic. And further, that in light of this epidemic, the board requests that the Government of Ontario and other vested stakeholders increase the funding and resources for such services to meaningfully address and end this epidemic in Ontario, and that this motion be forwarded to the Ministry of the Solicitor General and the City of Greater Sudbury.
That motion has been duly moved and seconded. Time for questions or discussions on the motion. Member Lefebvre?
Well, just maybe to where this motion should be forwarded, we should include the Minister of Health as well.
Okay.
The Minister of Solicitor General, but the Minister of Health should be obviously in there.
Okay, so duly amended, Minister, Solicitor General, Ministry of Health, and the City of Greater Sudbury. Is that what you'd like?
Yep.
Member Poland, do you have any thoughts on the motion? Member Forte? So we'll call for the vote. All those in favor, and it is carried unanimously. Thank you very much. Thank you, Chief, and we've already thanked Dr. Coca and Dr. Leary. Hopefully now, Member Lefebvre will put your mayor's hat on that you're going to get this motion, and hopefully Tom Gervais, we can make sure he gets the motion for Solicitor General, and I'm just not sure how we'll get it to Sylvia Jones, but I'm sure somebody will do that for us. Back to our agenda. So we have done consent, so we will now go to discussion agenda. 2024 Post-Traumatic Stress Disorder Annual Report. Chief?
Thank you. Through you, Chair Lougheed. The Greater Sudbury Police Service continues to take a real holistic approach to addressing and assisting our members' overall well-being. We just launched an internal, what we call thought exchange, again, reaching out to our members to say, where can we do better in this aspect? Of course, you'll see in our strategic plan that our members are our number one priority, and that continues to be so. And again, this document just highlights, some of the great things we're doing. But like I just indicated, we've reached out to our members to see where we can improve in this area. So just some highlights from this. You'll see our wellness coordinator is James Jefferson. As you know, James Jefferson has a story, lived experience on his journey. And James, in his role, is a certified trainer. You'll see lots of the things that he's able to do with our members in supporting them in health and wellness. You'll see he has fitness plans, nutritional resources, and through collective bargaining with our association, one of the things that's embedded in our collective agreement and procedures is should a member continue to get their fitness pin, their annual fitness pin, which really is the testing that gets you to be hired as a police officer, they are allowed or permitted a day off. Which is great. So that's an incentive for our members to continue to maintain their physical fitness. You'll see that we hosted 16 warrior coffee sessions, and these are sessions where anybody can go, members of the service, and just really sit down and have group discussions and supporting one another, whether it's coping with depression, anxiety, PTSD, whatnot. So we continue to run these warrior coffee sessions, usually led by James Jefferson and Ryan Hutton, who this board had a presentation by both. Ryan was highlighted last year. Beyond the Blue recognized him for his contributions to Blue Balance and wellness. Our employee assistance programs, of course, through our EAP. You'll see psychological psychotherapy. Again, a huge initiative under our collective bargaining, a $10,000 offset for members to continue to, we want to make sure when we hire individuals they're psychologically sound. You'll see that there are some of our officers that have to go annually just based on where they're working, whether it's an officer in the traffic management unit who has gone to numerous fatalities or an officer investigating, child pornography. We make sure that they annually see the service psychologist. You'll see we have a peer support team. We have 39 members trained in peer support, and it highlights some of it's through a Peer Connect app. It's anonymous. We reach out to the 39 members, reach out annually. You'll see that there's 51 check-in recommendations made. That's simply something, I noticed. I recently had a conversation with Officer X. They seem to be struggling. You can make recommendations for a check-in from a peer supporter. So, we're doing a lot of great work in this area. I always say there's room to improve, and we recently checked in on that. You'll see critical incident debriefs. Again, these are like major incidences. So we have the team come together from the frontline officer to the 911 dispatcher to the tactical team to debrief and look at the situation and talk about that. And of course, we have internal wellness pages. Again, information on resource, fitness, nutrition. So it highlights a whole bunch of great things, and we continue to support our members any way we can. So I'm open to questions.
Chief, questions? Member Poland?
Thanks for the report. It was actually quite excellent and thorough. And I think, as this group knows, this is a very important piece for the board, for leadership, for service members. And if you wanted to highlight, we continue to see improvements and more work being done in this area. It's just an opportunity, Chief, to underscore for us what's been new this year as we continue to build our wraparound supports and services for our members.
Yeah, so if I hear you correctly, what has been added new in 2024? So again, annually, there's certain things we do. PTSD walk. So we've been walking. We had a walk this year, and it included our EMS partners. It included our military partners. It came a PTSD walk again, and then we came out to Tom Davies Square here and just highlighted, it's okay to not be okay. And that's our continued messaging. And I want to say that is not new, but we're really pushing that forward, and if you're not okay, we have all of these things for you to come forward, through HR, through James, through the Peer Connect. We're just making it more accessible for members to reach out for help. And again, what we're doing with the association, I'm happy to see President Hall join us today, is, those that have gone off, what are we doing to work really, really hard to bring them back into the organization? Making sure they have those supports, but again, working on, how do we reintegrate them back into the organization and make sure moving forward they have supports.
Poland, you're good with that? Member Lefebvre? Porche? In conversation with the chief, I did ask the peer support team, you have to sign up for it. It's not automatically, you're not part of the peer support team. So the question I raised with the chief is that how do people know to sign up? Because we have a 38% members have signed up, which means 62% haven't signed up. And I guess the question is they don't need it or they don't believe in it or what it may be. So Chief, in that conversation, you also indicated the newly sworn in officers in their orientation, they have an explanation of this. Did you want to share that with the other board members, these ideas?
Yeah, no, for sure. Not mandatory. We made sure that all of our supervisors have signed up, and so this was new to the organization. So a lot of members currently, already embedded in the organization. So it's getting that buy-in. Often too, they want to know that it is anonymous, that the information isn't being shared. With the executive team or whatnot. And with our new recruits, James Jefferson meets with them pre-OPC as they go on their journey to OPC and then post-OPC. And he has them, he highlights them, and our new recruits are signing up like right away. Again, this is something we think is important for our members. You'll get a reach out. I had my annual reach in from a peer supporter, just checking in, seeing how things are going. Things are great. It's just an avenue, and all of our, again, 39 members, they're selected based on kind of where they are in the organization. We have somebody up at courts, we have somebody in the drug unit, supporting. And so we've kind of put everybody, all over the organization, and then they spend a couple of days training on this peer support team.
Sounds good to me. This is for information that the recommendation that the Greater Sudbury Police Board receives to 2024 Post-Traumatic Stress Disorder Prevention Plan Annual Update for information. So, Matthew, I don't think we require a motion on this one. We've received it for information. Moving next to 2024 Property and Evidence Annual Audit. Chief?
Yeah, thank you, Chair Lougheed. Again, a very robust report here. We have 3 trained auditors in our service. So every year we have to, prevent our, it's legislated that we do the audit of our property and evidence control unit. You'll see that the auditor attended, and here is her report. Last year there were some concerns that the property evidence staff would tell an officer either post conviction in courts to release the property through Deputy Hiltz. There were some concerns last year that the evidence wasn't being released by the officers. That seemed to be the bottleneck. You can see by this report, we have put into place some practices ensuring the officers are doing that in a timely fashion. You'll see that we have done a little bit better this year by all accounts. And again, we reviewed our current procedure. It has been revised and updated as of March 26th this year. It is in alignment with the new regulations of the CSPA, and of course, very consistent with the provincial standards. And again, it was for review. If there's any questions, you'll see that in 2024, we brought in a little bit less property, 58,000 compared to 2023, 6,000. And again, we're disposing of most of the evidence or the property seized.
Questions? Member Poland?
Just a very quick comment. Another good report and good progress being made in this area. So thank you to you and the team.
Appreciate that. Thank you.
Dave? Forte? Chief, just it was a bit of an enlightenment for me that the release of this property needs the officer in charge to let it out, correct?
Correct.
You might want to tell the rest of the board how that works because that could reduce the numbers quicker. If it's not signed off, we have to hang on to the evidence, correct?
Yeah, well, and there's numerous processes. Sometimes it's kept for safekeeping, a firearm in which a deceased member, and we're holding on to it. Through the chief firearms officer, we're trying to find someone else in the family that might be able to acquire the evidence. It could be that we're waiting on an appeal process in the court system, and so the officer will be notified. Wait 30 days, allow the appeal process. But it does always go back to the investigating officer to do the release. And so once it is released, however, accordingly, disposed of, returned to the owner, then the property evidence staff go about doing the release of that. And so if it's released back to the property owner, should court say that the individual gets their firearms back, they set up an appointment. It's all through the property and evidence department.
You. If there's no other questions, that was for information as well. So thank you for that information. Moving then to our Equity, Diversity, Inclusion Annual Report.
Yeah, so happy, to see Chelsea Gauthier, who's up in the gallery there. So the board last year approved the hiring of an EDI strategist, and Chelsea Gauthier is a successful candidate in that area. She's doing great work in this space. Again, when it comes to our EDI, endeavors, really it is coming to building trust within the community and building trust in our own organization. So we're doing a lot of work in this space as well. We continue to have engagement established internally through, working groups. And one of the things under, Chelsea's purview now is we had several working groups and there was a lot of overlap happening. And so what we're doing now is trying to, bring them all together under an umbrella of developing an inclusion, diversity, equity, accessibility, and anti-racism committee. Before we had, several different committees. So now we're coming forward to do heavy lifting as one. And again, you'll see lots of, things that we were involved in both internally and externally last year. From our work with our Indigenous youth and our programs there, as well as, several engagements with our places of worship tours. We had all of our new recruits go and do the places of worship tours. On Sunday previous, just past here, I was at a Seder Passover with our Jewish community, which was lovely. I know the deputy mayor joined me as well. And the fact that we're being welcomed, to come as the police chief to, break bread with our community really does highlight the work that we're doing. So again, we're looking at expanding some of that. Chelsea has just presented. We had a 1-year strategy under Chief Pedersen, and we're looking at a 3-year strategy, and hopefully, again, moving forward both internally and externally in this space.
Vorche?
I was actually going to ask you who the EDI strategist was. So welcome, Chelsea. Thank you for all your hard work. There's a lot of great initiatives and programs detailed, and another great report.
Thanks.
Poland?
Again, a great report. Chelsea, welcome. The gifting of an eagle feather is not random, and we've been gifted too. Perhaps a little background on that?
Yeah, no, for sure. Again, yesterday I attended the Northern Water Sports Center, and Daryl Rivers, Constable Rivers, is hosting an Indigenous Liaison Officer conference these past 2 days, and Grant O'Keefe was there. And as most of you know, Grant was our first ever Indigenous Liaison Officer in 1999, and he was there speaking of the history. And we're very, fortunate that we've had some strong people in this area. Constable Rivers will be ending his tenure at the end of this year, and Constable Katrina Pinawanaquat will move into that space. But one of the things, Daryl has done, again, just as built a lot of our community relationships. And so, as you know, Member Poland, the eagle feather is a sacred symbol of honor, respect, spiritual connection to the Creator. And so, one of the things that I'm just noting here, because Daryl, we had a beautiful presentation. They actually gifted us a very detailed, it was carved wooden box where the eagle feather will remain. And through Daryl, we have at Chicago McQuay, as well as our CID officers, have all been trained. If an individual wants to use the eagle feather well, making their statement to police. And so we've been on this journey a long time. And again, this gift was given to us by the Anishinaabe community. It's the first eagle feather, dates back to 2019, where it was introduced to GSPS during a partnership. And so in the fall of 2024, we held a ceremony, and we've added 2 feathers that were gifted to us. And we've written a policy to ensure that our members, of course, are being respectful. And then we had a feast that was hosted because it honored the feathers, as they are part of the PS family now. So some of the protocols we've introduced are you're to smudge yourself thoroughly and say a prayer to the Creator before using the eagle feather. And the eagle feather with sweetgrass or sage from time to time, you're supposed to smudge again, because what they say is you don't want to keep the trauma of the individual who used it before. So we're very much abiding by, the rules of engagement, and we know that this is a great gift to us, and we're happy that it's been presented to us.
Dave?
I'm just to highlight that one of the sentences that we have, GSPS is deepening its commitment to EDI initiatives. So I like that. Keep going. Thank you.
Thank you.
So, Chief, I guess in our conversations, the also building the relationship with the Pride community, and I think you've addressed that you are working towards that end.
Yeah, we spoke about that, and I feel that the individuals currently sitting at the table, we want to work further together, and our door is always open, and we're going to work on building that relationship and strengthening that relationship, and supporting that community the best we can.
And internally, you actually have celebrations and gatherings and barbecues to make sure that we, in fact, are respecting and involving and engaging people, which is great.
Absolutely, yeah.
Also, board members, expansion of places of worship tour for police service members. I've talked to the chief about this, and I might suggest as board members, if you haven't done this, and obviously with my involvements in the community, I have, but the idea of visiting the mosque and visiting the 2 temples and visiting Christian worship, visiting the synagogue, if you don't have that insight or that background, I've asked the chief to let us know when those visits are happening and that board members could attend those visits. my personal experience and my professional experience is once you are kind of knowledgeable with regard to that spiritual and cultural environment, it's a lot easier to understand certain decision making and who do you want to get decisions from. So again, I've asked the chief in future visits that we would be included in the invitation. Chief,
Yep, absolutely. We'll make sure that happens.
no other questions. This was for information and recommendation as well. So Matthew will duly noted in the minutes. And now we come to donations reserve trust fund requests.
Yes, through you, Chair Lougheed, you'll see $650 in support of Stronger Together Youth Leading the Way event. And this is through our Chiefs Youth Advisory Council, so SEAC members. They did this last year. This year, we know Police Week will be at Cambrian College. And through the 4 school boards, they have requested 4 students from each high school. And the agenda for the day is, really just working with our youth on whether it's personal safety, internet safety. They've really highlighted a great day. And what they've engaged the youth to do is whichever group of 4 goes back and again takes it to the broader student body. And we see their presentation will provide a school with a pizza party. So, that comes from, again, the SEAC youth advising the chief on, some of the things they're seeing in the community. And that, again, is internet safety. They're going to do because they're grade 11 students, again, impaired driving. So lots of things that really is, work in our space. And again, youth leading youth. So I definitely support this. And the next is $3,000 from the Mason family donation for a basketball mentorship program. And this is exciting in the fact that, there's others in the room that can speak to this. So Jeffrey Mason, unfortunately, was murdered several years back, and his family made a donation through the donation reserve for youth basketball. And I believe, Chair Lougheed, you can speak to this a little bit more, but we've partnered with the Sudbury basketball facility to have a program that will allow youth that would not otherwise be able to enter into a program like this and get some basketball skills. And through Inspector Brunette, we're going to also have some of our basketball team members, police officers join in this. And I think it's going to be a great initiative.
Absolutely, Chief. I think it's one of the best initiatives in terms of our board and GSPS. Um, Vice Chair Poland and I, a few weeks back, were reviewing the accounts and we found $3,000. And that $3,000 had been there for a long time. So the question was the Mason family wanted basketball initiatives, basketball training, basketball engagement to the community. George Ceres is the man that, in fact, owns and operates Sudbury basketball facility. George formerly played professional in France. He's played for Sudbury 5 for 2 years, and he is a very accomplished basketball player. He's also part of the faculty at SPAD at Laurentian, and he actually gives lectures in his classes with regard to physical activities. So he's very well qualified, very well educated, and just a super round, nice guy. And he does run a basketball academy. So Sean and I made a motion to, I think, is it Melissa? With regard,
Revere, yeah.
yeah, so with regard to can we now get this money out? So yesterday I talked to John Mason, who is the brother of Brent. He lives in British Columbia. He thought the money was all used up. He said, "This is a miracle." He says, "I can't believe my brother still has money with you folks. And my brother would be so pleased that there's going to be people getting basketball camps and training. And the person who'll even be happier is my 89-year-old mother, who still lives in Sudbury. And she will be so pleased that Brent's memory is still helping other youths." So, in fact, if you ever want to win, win, win all the way around, we win with helping the Masons, we win with helping kids that would not be able to get to a basketball camp, and we win with the fact that we have a very gold standard camp that we can offer them, and we win. And I will now, with the permission of the chief, because I've already asked permission, to ask Mark to give us a very brief highlight with regard to the Mason experience. And Mark is one of the more outstanding GSPS basketball players, and he will be sharing his basketball talents with those youth as well. Mark, over to you.
Thank you, Board Chair. Through you, Chief, if I may. A little bit of context. As mentioned, Jeffrey Mason was the victim of a tragedy in the fall of 2006. He was killed at the hands of another adult male, a young 18-year-old. At the time of his death, Jeffrey was 37 years old. Quickly, our service engaged in a homicide investigation led by a number of persons, many of which still are working here as police officers with the Greater Sudbury Police Service. Um, the tragedy, the crime was solved with an arrest for murder. The aggressor was convicted of manslaughter and served more than 10 years in a federal penitentiary. And on the heels of our investigation, as mentioned, Board Chair, the Mason family did a generous donation for youth programming, specifically for basketball. Here in Greater Sudbury, through the Sudbury Police basketball team, we did stand up a basketball academy in those years. It was called the Youth Basketball Academy, the Police Athletic League, rather, for a 3-year period out of Queen Elizabeth School. And these monies, of course, as you mentioned, are a surplus from that rollout. So it's great to see it's being used for a good purpose. I too had occasion to speak with George Sedes last night, and through the Sudbury basketball facility. Certainly, as you mentioned, George comes as an accomplished athlete, both professionally. He represented Sudbury for Collège Notre Dame, represented Sudbury as a coach for Laurentian University, and as you mentioned, professionally in France and putting Sudbury on the map with Sudbury 5. So all around, good news story. We learned of some great information earlier from Dr. Coca and his colleague. When it comes to healthy communities, housing was one of them. Engagement was a piece, and certainly we heard recreation. So when I think of this opportunity, it's I'll use your words. It's a win-win. Whereas it's an opportunity to perhaps provide those who otherwise underprivileged would not have this opportunity. This money will go for a good cause and support healthy communities.
Thank you very much, Inspector. And yes, Chief, did you have something you want to add?
No, I just want to make sure though that when we're selecting our officers, I need Mark to have good knees. So we'll go to our youth, our young officers to play basketball.
Yeah,
We'll get Mark to
I will
coach.
bring the ghosts of the past of Alisuma, Loch Thurkle, the guys I played with. And by the way, just so everybody knows, one of the basketball players, GSSPS used to be a real basketball force in Ontario.
Yes.
And in fact, we hosted, I think, the first provincial tournament here when Macaulay was the chief, because I think I threw the ball up. And the issue being is that Joe McDonald, who sadly was murdered on duty, he was one of our basketball players. I played against Joe. So the fact of the matter is there's a long tradition of basketball. The reason I'm spending enough time, we have enough time on the bad news stuff. This is just good stuff all the way through. Better Beginnings will get us kids. CIS is going to get us kids. The YMCA is going to get us kids. And these are kids that can't. And by the way, just so you know, it's not just playing basketball. They're getting a T-shirt. They're getting running shoes. They're getting shorts. These kids will play like any other kid in the community. And that's the good news that today that we have $3,000. And as I said, John Mason told me yesterday, this is a miracle. I'm not sure it qualifies for a miracle, but it's sure good news. So I think we're likely ready for some motions. Mr. Gation.
Thank you, Chair. That the board approve the following donation with funds drawn from the Donations Reserve Trust Fund, $650 in support of the Stronger Together Youth Leading the Way event, and $3,031.31 from the Mason family donation to the SBF Basketball Mentorship Program.
Being duly moved and seconded, all those in favor, it is unanimous. Moving right along with donations, now from our Reserve Trust Fund request, Chief.
Yes, through you, Chair. $1,500 request has been made in support of Muso's mission. So as you know, Inspector Musso is the mascot for GSPS. And one of our members, Heather Lewis, who, if any of you, most of us know Heather, but if any of you know Heather, Heather's got a great big heart. And she is looking to organize a project that includes service members, both serving and retired, to come together and give back to the community, specifically the Elgin Street Mission. It's going to be a 3-month pilot project. They're looking to come together and bake cookies for the Elgin Street Mission. And again, she says there's others that have recently done this. and I believe she spoke with you, Chair Lougheed. And so, again, happy to see this initiative come to fruition.
Yes, she has. About 3 years ago, I've got a couple ladies groups in our community out at St. James in the Valley and All Nations. God bless those ladies. As of last month, they have provided 51,000 cookies to the Elgin Street Mission. The reason you may say, why do we want to talk about cookies? I'm not against Jello. I grew up on Jello, a lot of Jello in my life over in the West End. But at the mission, if they don't have homemade cookies, they get Jello. So needless to say, when they got 51,000 cookies over the last 3 years, the folks at the mission, as we call them, our diners, were just so really pleased. Heather thinks this might be a good morale booster with regard to the sworn, the retired, and the non-sworn. And let's see what happens with it. And it's coming from our reserve fund. Any questions? Sean, you look like you got a question.
Will they be moose track cookies?
I'm not quite sure. They could be good. We'll take that as a recommendation.
Absolutely. Motion, Mr. Gation.
That the board approve the following donation with funds drawn from the Police Services Board Reserve Trust Fund, $1,500 in support of Muso's mission.
Duly moved and seconded. All those in favor? We're in favor of homemade cookies. Thank you. We're moving to our board administrators report. Matthew, do you have anything you want to highlight in your report?
Just a couple of things, again, busy month, things move quickly from one meeting to the other. I was very happy to and honored to attend the spring welcome ceremony for the new members, along with some of our board members. It was a great ceremony to see our new constables and special constables. I just wanted to sort of tack on to the EDI report, your comment about attending the worship tour. As I highlighted for the board previously, I have been working with the EDI strategist as a, work is going to be both a board and service sponsored EDI strategy. So the board has had input on that. And that was one of the recommendations that we discussed. And so that the board take part in the worship tour. And so once a schedule is developed, I will be reaching out to the board to make sure we can get everybody on a date that works for them. And that'd be great to take part in that.
Thank you, Matthew. Matthew's doing a great job just for, again, the community and our gathering today. That as board members, we very much have appreciated your last few months and the good work you're doing, Matthew. So thank you. Moving on to report from the chief, and I believe it starts on page 63, Chief. And I think all of our board members are pretty literate. So do you want to kind of just field any questions for each of the reports? Is that a good way to proceed?
Yeah, happy to do that if that's how you prefer.
So folks, on our community safety and well-being, board members, do you have anything that you would like to highlight? Yes, I do, because I'm going to the bikes. So I very much. Inspector DePace is with us today. Something I know Deputy Hiltz likes to tell me about the 7 bikes they always get every month. So I appreciate those 7 coming back. But as I mentioned to other board members, I am tired of every one of my neighbors and friends telling me about their kid's bike being stolen and nobody takes an interest in finding it. So I have brought this up every meeting, as you know, and I'm so pleased to see the report today about the 529 garage program, which in fact is going to be kicked off, I understand, a few minutes ago on June the 1st. Chief, do you want to just remind us what that is, or Inspector DePace, however you want to proceed?
Yeah, no, happy to remind you again. You are correct. You brought this up several months ago, and through research of Inspector DePace and his team, we've partnered with a local program here, Garage 529. Again, we've told the board here it allows people to register their bikes. We are going to launch it in connection with the Mayor's Bike Month on June 1st. So again, happy to, we're in the process of doing our education and kind of advertising. And I believe Inspector DePace said at last meeting, we're using the city's billboard. We're having some, I believe, brochures made up. We're going to be in the schools. Again, we want people to come and register their bike through this program. And Inspector, do you have anything you want to add to that?
No, that's good. Thank you.
Thank you, Chief. Thank you, Dan. Good job. And again, Patrol operations, do you want to tell us any questions on patrol operations, board members? Chief, I think you might want to update us about Cop Logic and what your technology is moving to, though.
Yes, so through Inspector Brown, I see him there, and Nathan Dokis, just again doing some research, and I don't see that Andrea is here today, but when the call for service comes into the 911 ECC, and again, it's generally where there's no suspects, and we say no suspects at the time of. However, when it goes to our now called E-Platoon under our new organizational chart, it was the Police Community Response Center. However, it's part of patrol operations. It's simply a different call for service that we're not dispatching an officer to. We are moving to be able to, for lack of a better term, FaceTime with an individual to see them face to face through some grant funding we got, and it's called victim choice reporting. But it simply is a different reporting mechanism. And I know, Chair, you know this. Recently, we've had some copper thefts. And again, no suspects. However, our e-platoon has been able to bring the data and analytics together and show crime trends. And so it could be weeks, maybe months later, that we identify a suspect. So it simply is a different way of people being able to report online. The platform in which we've been using, over the last several years is called CopLogic, and we're currently investigating a new, what I would suggest, a more robust system that allows us to garner analytics. It allows us to provide a customer service survey at the end of the engagement with the individual. Hopefully, it'll allow us to, uh, tell the individual where they are kind of in the queue of, reporting, because often, people are saying we haven't got back to them in 2 weeks, and that's, shouldn't be happening. We should be, engaging these folks. So we're definitely looking at a different, more robust reporting system for online reporting, and making sure that our community members don't feel that it's gone into the ether and no one's actually doing anything about it. We're investing in that space.
I think that's great. And because again, I think that just nobody gets back to me is a frustration sometimes in the community. So I'm really glad to hear the word robust. And I know the copper issue, Steve Matautas, the lawyer in town, had his copper taken off his building downtown, used to be the Sudbury Star building. I know Dr. Bora had taken his copper. Oh, and Jackson Barn Funeral, we lost our air conditioner. So the fact is, if there's enough of this, I think the pattern is you're going to follow it up. And I think the community will be happy you are. So thank you. Any questions, folks? Nope. Moving on in the report, integrated operations. Do you want to ask any questions about that? I thought the good news is you did have a crackdown on distracted drivers.
We did, and it comes back, to the education, and people know it's against the law. People know it's against the law to speed. People know it's against the law to drive impaired. Unfortunately, people still choose to do so. So again, every month we try and tackle an initiative, and unfortunately, we still see individuals driving distracted with their handheld devices. So, and if I can just highlight, last meeting we continue to talk about, our ride initiatives, and we met this week, Inspector Burnett, Inspector Norman, myself, and Sergeant Ramsey out of the traffic management unit with Leslie Green and her team. And as you know, she moved away from the Operation Red Nose to Safe Ride Home. Again, it's through the holiday season, but Leslie comes out, to our ride checks throughout the year. And what we're now looking at, and we spoke about it last month, Member Lefebvre, is more education. How do we continue to say to people, again, just knowing it's illegal doesn't seem to be enough. Knowing that you can kill someone doesn't seem to be enough. Knowing that, your vehicle will be impounded and all of these things doesn't seem to be enough. So we had great discussions, and what they've done through Leslie and her team, not only police are at the table, but they've brought in some community leaders from Valet, from FCR, from Sandvik Mining, just again, community partners that are wanting to help and lean into this space, and, look at ways that we can better educate. And this Joseph, I'm not sure of his last name, from over the Atlantic, and he assists Leslie with, the billboards and stuff. So we're going to be coming to the city, maybe the billboard out in the valley. Again, just some better messaging, so we can remind the community of, impaired driving.
All good stuff. That kind of is always my question, and you've answered it. So thank you very much. Any other board member want to ask the chief anything about that? If not, criminal investigations, I guess, Member Lefebvre, I think we did address that earlier. Are you still satisfied with that? Great. Any other board members? Sean, Krista, you got any questions on that? Um, So that, Chief, is there anything, we're kind of at the end of those types of reports. Is there anything you want us that we might have missed?
No, again, just some great highlights from our criminal investigations division. Lots going on in that space right now. We're busy tackling some major investigations, and these are just some highlights. And lastly, again, corporate communications. You'll see our new members, and thank you to the board members who came and welcomed, our new officers as well as our new special constables. And thank you to Inspector DePottier, who again went out and engaged with our community and did Meals on Wheels. We had a great day of International Day for Elimination of Racial Discrimination. We partnered with SMAFA, Sudbury Multicultural, had some newcomers, again, break bread, engage with our officers, learn about each other. And I think that's important in building public trust. And we launched our MICWA program again. This is allowing Indigenous youth through our local high schools to come and participate in a ride-along program. I'm happy to say that we have, some officers that went through this program. So again, it highlights, building relationship. We've heard today, and again, it's making sure that we engage early with our youth. And so we launched that. This one here, canine macaroni. I don't know if you're on our social media, but on April 1st, we put out canine officer Vitali, and he went to the canine truck and opened it up, and out jumped about a 15-pound pug. And he's got a vest and everything. And our social media blew up the way it's never blown up. And it says 12 million. As of yesterday, it's been shared so many times. There's 17.1 million views on this macaroni. He belongs to one of our analysts. And he's just not only, and so, I wanted to highlight, and again, I don't see Andrea, but it's National Telecommunications Week. So of course we're highlighting our 911 ECC members. So Macaroni was up there doing the rounds this week. So when we talk about just feeling good in the workplace, this little pug has really helped us, not only on our social media platforms but internally. So.
Any canine questions? Anybody else want to, April Fools? We're all good. I think you may want to highlight for some of maybe the board that wasn't there, that I understand, at least I think we understand, that in the swearing in ceremony, that was the first officer to be sworn in with a turban.
That's correct. Yes. 2 officers,
Wow.
as you noted. Yeah. And so, again, happy to see that, we are becoming more and more diverse internally. It was wonderful to see that evening. One of the new officers introduced me to his mother, who had traveled from India to be at the Ontario Police College several weeks back to witness her son graduate. And she's spending some time here in our community for about 2 months. But you heard that night that one of our members came to Canada several years ago. I think he's got 2 degrees now from Cambrian College, with nothing more than a backpack. And his dad is a high commissioned officer in India. And, this was a dream of his that he never thought he'd see come to fruition. So very happy that he chose us, that he chose GSPS, that he chooses to continue to stay in the Sudbury community. And I think it's a win-win for all of us.
In the backgrounds of just about everybody that was sworn in that night seemed to have a police connection, whether it was in India or in Canada. So there's some pretty sincere and pretty passionate people being sworn into our police service, which is good too.
Yeah.
So that's all our reports. New business. Member Poland, any new business? Dave? Orche, we've got no new business. So it's 11:34. I would assume that we will have a motion for adjournment. Our next meeting will be on June the 21st. It will be noted in our calendars. I think we have a motion to adjourn
Yeah, sorry, Member, that was a typo. It's actually, our next meeting is June 18th.
June 18th. All right.
My apologies.
3 days back. We're not going to meet a weekend. Moved in second. Do you want to read it?
Yep. That this meeting be adjourned.
All those in favor? It's passed. Thank you all. What? That's why we have them coming.